achieve that. So today we would hear from people who will help us figure out how to tell our story in an impactful way. We would hear from people who will help us learn how to effectively engage with elected officials. And then we're going to end this session with a nice chat with our elected officials. Some are current, some are formal, but we will just hear from them in their own words. How can the sickle cell community better advocate for sickle cell causes? In this case, we have state officials, but everything you're learning today should help you be able to engage with your local, meaning county or city, your state, and ultimately your federal elected officials. So I want you to relax. This is going to be a very informal session. I want you to there's going to be food. Once the caterer is ready, you can feel free to get up and go and get your food, get your drinks. But I definitely want to say thank you to all of our sponsors. Our financial sponsors are Vertex Pharmaceutical and Every Life Foundation. Without them, I don't do all this by myself. There are people helping me, especially financially. So shout out to Vertex and Every Life Foundation. All these wonderful logos you see on the back of me here, each one of these entities did something to help get this event to where we are today. So thank you to all of our partners. Our Commissioner, Felicia Franklin, she has a little bit of announcement for us, and she's gonna give us that announcement, and I would like for Nia to come in. When it comes to sickle cell disease, I want the community to understand that we're all in this together. There's another summit that's gonna be happening, very much in line with what we're doing today, so if you can benefit from that, please go ahead and sign up, and Nia will tell you more about it after. Ms. Commissioner.
Good morning, everybody. Thank you for everyone coming out. And first of all, thank you for your fierce leader. You could not have a better advocate. Definitely. I think y'all need to clap a little bit more. This young lady does not sleep. Literally, I'm getting emails at 6 a.m. in the morning. And I tell folks, when you have children that are dealing with sickle cell yourself, going back and forth to treatments, but yet and still you stay up to fight to make sure that you advocate for others who are dealing with the same disease and the effects on their family. Let me tell you, my hat is always off to her, and it's always my pleasure to support you and your efforts and your board's efforts because of the amazing work that you're doing. So I wanted to share something with you all really quickly. Just so happened that I got a call yesterday from one of our citizens, and she works with the National Parks Services. And actually through all federal government jobs, I wasn't aware of this, there's something called Schedule A. I want you to remember that. And you all have a copy of it that's going in your folders. I think there's a handsome gentleman that's passing them out over there your way if you don't have it. But you actually have the two forms. When I found out about it, I wanted to make sure that you got it immediately. So what the Schedule A does is it makes space for those with sickle cell or those families that are dealing with sickle cell for you to be able to be in these jobs with the federal government, to apply for them without competition. They can hire you. I'm gonna say it again, without competition, they can hire you. And it's actually called the Schedule A Letter for Vocational Rehabilitation of Professionals. And so you'll fill out this self-identified disability form. And remember, it doesn't have to be a physical disability where someone is not able to walk or talk. It could be anything at all. And so why is it important for you all? Because those that are dealing with sickle cell and the effects of sickle cell, it gives you an opportunity to not only earn a living for your families, but also go in without your disease being used against you, but allowing you to have that position. Now, I passed the information out, and this is a sample letter to tell you how to get it done. Please share this information, okay? God bless y'all and take care, and thank you again for all that all of you do.
Before I bring up Mia, I do want to say thank you to all of our volunteers. Shirley and her team do a phenomenal job making sure that everything that you see here that's all set up nice and neat, that all of that is taken care of. So Shirley and all of the volunteers, Dr. Kalami, Ignition, Tayo, we were here last night getting this stuff ready. So thank you to all of our volunteers. We appreciate you. Now Mia, if you can go ahead and give us some information.
Good morning, everyone. Good morning. I'm glad it's gorgeous outside because yesterday it was a little ugly outside. So I'm so happy the sun is out. Wish it was a little warmer, but we're going to take what we can get. I'm Mia Robinson. I'm a warrior and I'm an advocate. I really work in the Atlanta DeKalb community, but I'm also international. So I'm here representing the Sickle Cell Community Consortium. They are having a national SCD policy forum where we get to meet with our legislators and have this conversation with them. We can use the talking points and the information that we were given today, but Sickle Cells also has a toolkit on other things that we can focus on and who we need to talk to. Most times we talk to the representatives, but there are some where the actual congressperson is there. Hank Johnson with DeKalb County, he's good for showing his face. So please register. You can go to sickcells.org, register. It'll ask you for your zip code, I think your address, just to make sure they're scheduling you with the correct people. And I hope you enjoy it. It's really beneficial, but they need to see our faces and they really need to hear our stories in order to have change, you know. Yeah, and it is virtual, I'm sorry. So it doesn't matter where you are. We're not flying to DC, which would be nice, but you can just do it from home because it is virtual. So make sure you sign up, sickcells.org, look for the National SCD Policy Forum and sign up. So I hope I see y'all there. Thank y'all.
What's the date, Mia?
21st.
21st?
And 22nd.
The 21st and 22nd. So next week.
March.
Yes.
I'm sorry.
It's next week, right?
March 21st.
Yes. All right. So next on our agenda, we are going to learn all about owning our narrative. How do you effectively tell your story? Because as advocates, really all we have are our stories. So how do you harness your story and use it effectively? I am so honored to have this next presenter. I have known, Nakia, we've known each other for years. Oh my goodness. And she's all the way in Maryland, but we support each other. And when I found out she'd be here in Atlanta, at this time, I said, girl, you gotta come and give us some of that magic. Now, she was very instrumental in ensuring that a legislation in Maryland was passed. So I definitely wanted her to share some insights with us here today. So Nakia, everybody help me welcome Nakia.
Good morning, everyone. How's everybody doing today? Bringing you greetings from Baltimore, Maryland. My name is Nakia Vaughn, and I am the wife and mother of 2 sickle cell warriors. My husband, Shimon Vaughn, is here with me today, and my daughter, Simone, is back at home in Baltimore. Today, she is doing her first showcase as an artist. So, you know, I cried tears when they called and said she was going to be in the showcase and I was going to be in Atlanta. But she's 10 and my family, my village made sure that she was able to get to her showcase today, and I'm a proud mom. And I also have a son, his name is Langston, and he has the sickle cell trait. So today we're here to talk about owning our narrative. So I could talk all day about sickle cell disease and all of those things, and I'm going to keep it really short. So I'm going to talk a little bit about my story. So when I was 32 years old, I became pregnant with my son, Langston, and went to the hospital, got all my blood work done, and they said to me, yeah, you have sickle cell trait. And I'm like, what? I never knew I had sickle cell trait, right? 32 years old, and his dad had to get tested. And his dad was like, oh, whatever, we're fine, And come to find out, his sisters, 5 sisters, all had sickle cell trait. So I was like, oh my goodness, right? I had no idea. All I knew about sickle cell was like T-bars, right? So he tested, he didn't have sickle cell trait. So the most we knew that Langston would most likely either or have the sickle cell trait, because of course it was a 50-50 chance that I would pass it. So when Langston was born and he got tested, he had sickle cell trait. So I was like, okay, it's gonna be my one and done. I'm not having any more kids, I don't have to worry about it. But then I met the love of my life, right? My husband. And my husband didn't have children, and so, well, first of all, we went on our date, and I noticed, and he's okay with me sharing this, so I noticed one day, like, we went on a date, and he was, like, kind of walking like a limp, a strong limp, and I'm like, he's a football coach too, right? So I'm like, I said to him, I'm like, are you okay? Why are you walking like that? And he said to me, when I was 3 years old, I had a stroke. And I'm like, okay. And he's like, I had a stroke because I have sickle cell disease. So in my mind, I'm like, oh my gosh, I have sickle cell trait. He has sickle cell disease. I already knew that he was going to be my husband. So I was just like, what are the odds of the love of my life having sickle cell disease and I'm having sickle cell trait? Long story short, we became pregnant, and I was just like, what is going to happen? So I talked to my doctor at the time, and at this time I was 35. So there's a test called Yes, that test. So she looked at me and she said, now Nakia, you're 35 years old. If you have this test, there is a risk that you'll miscarry. And she said, if your baby girl has sickle cell disease when we do this test, are you going to stop pregnancy? And I'm like, of course not. So she said, you just need to go on with the pregnancy then and just pray over your baby. And whatever happens, you're going to love her, and it's just going to be the life, right? So that's what I did. So we opted not to have the test. So 6 weeks go past, with the traditional family of staying home, but it's time to go back to church, right? We started staying home, so we went to go get the baby's first outfit for church. So while we're in Target shopping for her dress, I get a phone call and it said, Maryland State Department of Health. I answer the phone. Simone's in her little stroller, and we're looking at the dresses, and the nurse calls and says, hi, this is nurse so-and-so from the state of Maryland, and we're calling to schedule your baby girl's first hematology appointment. And I'm like, excuse me? And she's like, yeah, Simone. And the look I had on my face, my husband was like looking at me like, what's going on? And my thing was, we never heard, it's like no news, good news, right? So I never got the notification in the mail that Simone had sickle cell disease. So my husband, this football coach, he picks Simone up and he looks me in my eyes and he says, Simone has sickle cell, doesn't she? And he takes Simone and he's crying in the middle of Target, and he's like really crying, and I'm trying to stay really positive, and he's like, this is all my fault, right? The associates come over and they help us, and it was really, really, really tough. So at that point, I knew that it was going to be my job, that I was going to have to advocate not only for my husband, but for my daughter. And so I really didn't know too much about sickle cell because he did so well. His mom took really, really good care of him. And he really, was doing well, so I didn't really feel like a need to really learn. But when I found out that Simone had sickle cell disease, that's what happened. I became really, really involved. To the point that I started working at Johns Hopkins as the community health worker for sickle cell disease. Like, I took it that serious. My mother went to the library, she caught the bus and got 2 books about sickle cell. I called sickle because, you know, SCDAA is in Baltimore. I called and they were like, oh, you have to call the local chapter. And I was just all over the place. So long story short, that's what my life became. I became an advocate for my family. And so from that point on, I knew how important it was for me to be an advocate with this disease that is like so well known, but with so little resources, right? So time for Simone to go to school. We're gonna fast forward up, time for her to go to school. So I'm in the school and I'm like really advocating. I'm a part of the Maryland Sickle Cell Disease Association. I'm working for Johns Hopkins, and I'm always in the local communities talking about sickle cell disease. Became a part of the national chapter with the SCDAA, and I go to the school board. And I go to the school board and I say to them, hey, my daughter has sickle cell disease, and I would like to advocate for any other child in Baltimore City, caregivers, families that have sickle cell disease. I'm there at a meeting with Derek and Shantae Robertson at a community school meeting. And this man looks me in my face after I do all of this speaking about what I've done at the local school she attends and how we're just trying to advocate for those who come and self-identify themselves with sickle cell. And he looks at me and says, do you have legislation behind you? I'm like, no, I just want to be an advocate if a caregiver or a family member or a child self-identifies himself with sickle cell and says that they need resources. And he said, if you do not have legislation behind you, there's nothing that we can do. So, of course, I'm a big crybaby. I left the meeting upset. I was crying, upset. I was just like, what is this? So you know what I did, right? I went and got legislation behind me. That's what I did. So with the help of Derek and Shantae of the Maryland Sickle Cell Disease Association, we would go with Hopkins behind us, have Annapolis Day, which is our state capital, go and meet with our legislators, our senators, and Shirley Nathan Pulliam was our sponsor for our bill, which was Senate Bill 161. So I just want to kind of pull that up so I can say it correctly. Please excuse me. So, Senate Bill 161. Okay, it was the public school students with sickle cell disease guidelines. So we introduced it into Senate February 22nd, 2018. We were testifying. We would go to all of our legislators, our congressmen. We would have advocacy days and just sit there. And the thing is, if you have gone to your leaders, they like food. We would have food there for them to stop by and talk to them, write letters, call them on the phone, and Shirley Nathan Pulliam, she was our bill sponsor. We had our co-sponsors, and we would just talk about our stories. We had our sickle cell warriors there, the Maryland Sickle Cell Disease Association, Dr. Karen Proudford of the Proudford Foundation, if you all are familiar, and we would just sit and talk about why we needed this. So I went, I testified, told my story about Baltimore City Public Schools, and ultimately our bill was passed and signed without any amendment. So it was really, really great. And on that day, when I got the bill in the mail, I went to North Avenue, the Baltimore City Public Schools, and I asked to meet with the gentleman. I went there and I said, you probably don't remember me, but I came to you and I asked if I could advocate for sickle cell students and families. And I said, you asked me, was there legislation behind me? And I nicely placed the envelope on the desk and said, here's the legislation. Oh, and by the way, Simone is no longer Baltimore City Public School student. She's going to private school. So you will no longer get that money from her. I'm sorry. But all of your Baltimore City Public School students are now going to have advocacy from myself and from the state of Maryland. So that's what I did for our students in the whole state of Maryland, including the private schools. So when you go and you have whatever you need to do to advocate for your family members, yourself, for those that you love, you have to stand firm. As the doctor said this morning, we have not because we ask not, right? You have to use your voice. You are powerful. Don't ever let anyone look at you and that's going to be the end all be all, because they're not the end all be all. God is the end all be all, right? We are going to fight and continue to fight this narrative for our children, for our families. And I will continue to fight. And as we go for our families and our caregivers, and you understand it's really, really hard. You know, I look in the kit that we gave out, they gave out, advocating for legislation in Congress, and the first thing I saw was ALS. And it brought me back to a space. Remember the Ice Bucket Challenge and all of that? And I'm like, I never heard of ALS. And sickle cell has been around for thousands and thousands of years, and now you just see ALS everywhere. Why can't sickle cell be like that? Why can't we have a voice like this? You know, and we're here and we're trying all the time to advocate for our families and for our children. And, you know, we just need policy, we need funding, and we need all of the support that we can garner. And whatever we have to do to stand firm in our beliefs for our families, we have to do. It can be tiresome. I know. My three sicklers, she sends things to Simone all the time, and she, you know, she pushes, and you get tired, and you're like, even as a community health worker, when I had patients and I would go in and they would say to me, Nakia, I'm not feeling well, my doctors, my providers, you know, they're not treating me right, and then they would see me coming down that hall, and I would go in there and I would stand up for my patients. I'm like, let me tell you something. They're like, oh goodness, here she comes, little 411. Here come little 411, because I'm going to advocate for my patients, right? And it's not just it's my family. I go hard because it's my family. I know what it's like for my daughter to wake up and say she's having a pain crisis, and you know, for us to have that bag on the side and get ready to make that trip. One day we were taking her to the emergency room, and she looked up, I think she was like 4 or 5, Mom, and she said, I don't want to die. I'm like, oh, it's, you know, I have to. This is not a want, this is a have to. When I have other sickle cell moms who have lost their children, my good friend Tanya Durham, she lost her baby girl, and I'm like, this is what I'm supposed to do. This is what God has ordained me to do. And I eventually left Johns Hopkins to become an entrepreneur, and I still say this is my why. No matter what, I started my own skincare business, and that's still my why. So every time someone makes a purchase, I'm donating a portion of our funds to the sickle cell community. Just trying to do what I need to do to stay in the know. Becoming the Rare Disease from Everyday Life Foundation. I was the rare disease advocate for the state of Maryland of the year, getting the bill passed. Wes Moore, first African American governor of the state of Maryland. He came to my spa when I first opened, and he was, you know, you guys heard about Wes Moore? Yes, he's great. He came to my store and he said, what can I do to help you as a Black-owned business? And I told him the story of why I opened up my business. And he promised, I'm still going. I'm like, you know, because Governor Hogan, he signed our bill into law. And I said to Wes Moore, I said, this is my why. I would like for you to continue on with the same thing that, you know, I came in with. And he promised, sickle cell will be on the forefront for the state of Maryland. And I'm going to continue with my family, my friends, with my three sicklers, with Nia, for us to get the recognition that we deserve and that we need financially, policy, it is needed. So if there's anything that I can do for you when you need to go and speak to your legislators, when you need to go speak to your congressman, you can always contact me, and I'm always open, transparent to share my story, to help you write those letters, to help research, to get the phone numbers, to make the calls to your legislative leaders, because we elect them to do a job, right? They are elected to do a job. This is not something that they're like, oh, I'll think about it. No, this is what we elected you to do, to stand, to have a voice for policy and legislation. This is not something that, you just liaison fair. No, that's not what it's about. This is an importance to me, and it needs to be important to you as a community. We have to make sure we're standing firm with all of our policymakers, legislation, all the way up to the White House. So, before I leave this podium today, I want you to remember, if there's anything that I can do to help you with the legislation, policy, advocacy, or awareness, always know your story, know your standing in narrative, and make sure you stand firm in what you believe. Thank you so much for having me, and I love you all, and always keep faith. Say one thing. Earlier, the information was given out saying about the sample Schedule A letter. My husband is a proponent of that. He's a programmer for the federal government under the Schedule A. He is an IT analyst. Am I saying that right? Specialist, excuse me, IT specialist programmer for CMS for the federal government. So make sure, these things are real. So make sure, he's been with the federal government for how long? 13 years? About 13 years. So as we talked about the Schedule A, make sure that you are using these resources because they work. My husband gets up every day and does his thing, and I can't even get the cell phone to work. All right, have a good day.
So our next session is going to be on how to effectively engage your elected officials. What does that look like? What are some tips that we can all use to effectively engage our elected officials? Now, if you're looking in the program, you may see that this session is by Andy Lord, but unfortunately Andy is not here. So we will have Gabrielle Jones of Hill Collaborative come and help us, give us some nuggets. I've learned so much from Gabrielle, and this is going to be very informal. Gabrielle has a lot of tips and stuff. She has helped me through the years in really learning this legislative walk. I'm still learning, but if she can come and just, the Lord has called on me. So, Gabrielle, everybody help me welcome Gabrielle. And because this is really informal, we're all really just stepping in to help out with the sickle cell community. Felicia's gonna come out and help as well. So let's give it up for Felicia, Commissioner and Gabrielle from Hill Collaborative. Thank you guys. Here we go. Okay.
So I've been doing alliance development for a number of years. I started my career working in the pharmaceutical industry, and mine was very community facing. So it was, how do we kind of convene the community? How do we convene the community and help them understand that it's not just about voting? Because once you pull the community together to vote for your elected officials, that's just the beginning. So now let's actually get involved in the issues that we just voted our elected officials on, and now start getting down to the work. I think a lot of people are intimidated by the system of going down to the Capitol, going inside, and start now engaging on some of these issues. And they mistake politics for policy. What does that mean? And Howard Mosby, a former legislator back there, served a number of years. He always says this: policy impacts every aspect of our lives, and I don't think as a community we truly understand what that means. Education, housing, finance, healthcare, it really does. So as a community, we need to understand what that means. And then how do you engage with your elected officials? So that's what we're going to talk about. So when I was doing this work in the community, understanding the legislative process, it can be intimidating. I remember when Howard was an elected official, and I would go down to the Capitol, and I would sit in the hearing room where he was a member of that particular committee, Health and Human Services, on the House side. I would sit in the hearing room and see him as a member of that committee on a particular issue. And it was intimidating because I'm like, I don't know what a bill means, I don't understand that language, but he was talking about an issue that impacted health. And health is something that's important, right? Chronic diseases like sickle cell. But there are policies, everything that has to do with sickle cell disease. That's your medication, that's how you access care, that's how, everything. These are legislators that are looking at how your chronic disease and how you access that care and how you access those treatments. Everything is decided by those individuals that are sitting on that committee, right? And those bills. And that policy has a journey through that legislature and how it gets to the governor, and how it becomes a law. And we have to be involved in that process. Policy can't happen to us. It has to happen for us. And you have to be involved. So.
That is phenomenal. I love what you stated about you can't get politics confused with policy. That is key. And now, one other thing I do want to add, if you don't mind, is making sure that you also are working with those, as you just stated, making sure that those policies, as they're having those conversations, that you're in the room. It's very important that you've got to show up and you've got to be there and part of those discussions. As you were just talking about the process, a bill doesn't just get to the floor overnight. It has to start in a committee. So you want to look at these committees to see what is being discussed in those committees. And you have to definitely give a pillar Dawn a hand, because right now in the state of Georgia, you are pushing policy. You are making sure that the needs of the sickle cell community are being addressed at the Capitol, and that is so important. But a lot of times, people don't even know who their representatives are or what their representatives do. For example, I'm a commissioner, but as a commissioner, I can give opportunity for spaces. But as a commissioner, I'm also an advocate just like you for those that are at the State House. Those that are at the State House are going to be the ones that are really pushing that policy. So with that being stated, you got to know their schedules. When are they in office? When are they not in office? And don't start the conversation when they're in office and at the Capitol. Start the conversation now, because it may take a year. It may take 2 years. You may see that you need to add on the bill that is now being pushed through both the House and the Senate of the state of Georgia. And then also see what is already out there. There may be some health bill that's out there that you may see, well, this piece may affect us either positively or negatively, or maybe they need to know a little bit more information that could be added to that bill to help make sure that our needs are met as well. Because now what you've done is you created a force, not just those that are advocating for sickle cell, but now you may have others with other immune diseases that are now part of that force to be able to get the needs met within the sickle cell community. So, and I want to encourage that with you because I like that.
Okay, yeah. And one thing I do want to add too is always know your opposition.
Yes.
Because you can't just think about an issue one side. It's important to know who is out there opposing what you're doing. Because the last thing you want to be is out there, rah, rah, rah. Somebody shows up with facts that opposes your issue, right? Because they can come with a thunder on you and you're stuck there like, you know what, that makes sense. Because there's always going to be somebody that has data out there that those committee members that are looking at your bill or looking at that bill that can attach amendments or can attach something to your bill, especially if it's fiscal or has something to do with money, that can come in there and derail what you're trying to do. So when you're doing your research, find out who's opposing, what organization, insurance, especially in Georgia, the insurance industry has a lot of money, okay? And they carry a lot of weight. And they are looking at your legislators, campaigning, always look at your insurance industry and know who's out there opposing this stuff and do your research. Be clear and concise when you're communicating. Like, again, not a lot of talking, get your messaging down quick. Get the right person who's going to be speaking for you within your group. That can articulate your message. Make sure you have that.
And on the messaging too, I like the fact that with MTS, everybody's able to be on the same page. It's important that everyone is sharing the same message, that it is being heard over and over and over again. So this information that's being passed out today, make sure that you have it. You have it with you so that you can share additional information and make sure that that messaging is concise as you just stated.
And also, sometimes it's good to be a lone ranger and sometimes it's not. So find an organization that you can trust. Other organizations that you can trust and collaborate with. Heals all over the world. We work alongside you because there are organizations that may have resources that you don't have that can help you in your journey. So search out organizations that can fill the gap, things that you can bring on. So, don't be so kind of the lone ranger out there. Build your collaborative efforts, and not always just in your own chronic disease space. Mental health, if that's part of your area, pull in some mental health organizations, but again, vet them, right? Do your research and build your collaborative. Be persistent. Sometimes it does take time to get what you want. Again, Howard Mosley, known Howard for many years. I remember we were working on an issue around, I think it was step therapy. And many years ago, if you don't know what step therapy is, fail first, usually. And your doctors or your healthcare providers won't tell you that. They'll say, hey, try this, and then, try this for 6 months, and we'll step you up to the next one, or they'll titrate you up to a particular therapy. They won't call it that, but what they're doing is following your health plan. Actually, they are dictating what your health plan is telling you. That's not necessarily your doctor saying it. They're following what your health plan is saying. So there was a step therapy bill they were trying to get passed, the patient advocacy community. And it wasn't necessarily a particular chronic disease. It was the advocacy community in Georgia trying to get this legislation passed. And I remember I was trying to get to Mr. Mosby's office, a legislative visit, and I was able to get an appointment with him, and he said, you all should really consider a carve-out. He said, think about rather than getting all diseases, maybe think about a carve-out this time. And what a carve-out would do is look at a particular disease area that would capture a lot of people, like maybe diabetes or cancer, and then work your way up, because you're probably not going to get everything. And that's what happened. And then, it was something that I took back to the group, the coalition, and said, you're not going to get everything. So maybe this year you should try to just focus on a particular disease area and try to get a carve out. And what they did was they looked at mental health. So they brought together NAMI, MHA, and a bunch of other mental health groups, and they were actually able to get the legislation passed. And that was a success. And then later on, I don't know if you all remember the Jimmy Carter bill, they got cancer next and things like that. So it was just a recommendation. But we were building these relationships with legislators. And I knew Howard, and that was just a recommendation that he made. And it was me, and I'm sure there were probably other people that were meeting with legislators, but it was me making an appointment, going to his office and talking to him.
That's perfect. And when you go to visit, always stop in and talk to someone in another office. And if you walk around with your literature, with your, say, one-pager, then you're able to at least go in and leave the information if that person is not there. And so that goes back to what you were mentioning before about making sure that you are collaborating and that you are building those allies.
Yeah, I was going to say, if anyone has any questions, and then of any of the sessions, if you have any questions for Nakia, anything she said, if you wanted more clarity, if you have a question. We have a question here from Mia.
Thank you for the information that you gave. It was very helpful. You guys said be persistent. How often should we be bugging them? Like every week, every month, every quarter? Because I want to stay consistent and make sure that sickle cell is at the top or close to the top of their list. So what do you suggest as far as keeping up with them? How often should we do that?
So they're in session. Georgia has 40 days you're in session? The southern states, and I think they can share this when they do their panel. So the southern states tend to have shorter sessions, 40 days. I think the northern states have longer sessions throughout the year. And so the legislators are in their districts, back in their districts, longer days. So I think it's a little less difficult to reach them when they're back in their sessions. So you want to reach them when they're at home. So there may be opportunities to reach out to them when they're out of session. And that's when you do kind of your groundwork.
And what the key to that too is meet them where they are when they're out of session. I'll never forget once I was meeting with someone that was in office. And I knew I couldn't really get that appointment in the office. But I saw the person speaking at an event. And so then I went to that event and then actually called ahead of time and said, hey, do you have at least 5 minutes after your speech? I will be attending. So as you mentioned, definitely meeting people outside of the office and then meeting them at their own events, because then they'll be sure to remember you as well. You want to be rememberable, because then they'll remember you and the message that you carry.
And by the way, a lot of time, the time to do a lot of your work on your groundwork is definitely when they're not in session. That's when you're doing a lot of your coalition work, not championing your bills, but your legislation, but preparing your work, because Georgia goes into session in January, the first week of January. So you're out of session. What, the session ends in what, March? End of March. So you got basically that until the end of the year to do all of your work, your prep work, before the session begins in January.
So before we go on to our next question, do you guys want to add to the question on persistency? Any nuggets? Okay. So stay tuned. He'll address that during their panel. We have a question.
So my question is, do we as a community have as a sickle cell community, do we have an email database or an agency that advocates to send out what bills that we need to be pushing or writing our elected officials? Do we have that type of network?
We got this. Marquita, could you go ahead and go to, there's a slideshow with a QR code.
I want to answer that question. The organization I mentioned earlier, sickcells.org, is a completely sickle cell legislative advocacy organization. That's strictly their focus. So you can sign up to be an ambassador and stay informed on what's coming up, what's the talking points, what we need to be looking at and things like that. So that would be my suggestion. Just go to sickcells.org because that is completely what they focus on in the sickle cell community.
Slide 15. You see it? You can't see it? It's no 15.
No, I can't see it.
You can't see it?
No. Where is it?
It's okay, all the way to the bottom, right?
I can't see the mouse.
You
To
cannot.
do that, can you see the
Where's
mouse?
the
When
mouse?
I'm-
Oh, okay, yeah. Where's, I don't see the mouse.
Exactly.
So there is a website, and later there'll be a screen. There's a QR code, and when you click on, when you scan that code, it takes you to a website that basically has all of the different national policies that are, currently in Congress on sickle cell. One of them you have information on in your booklets is the SCD Treatment Centers Act. It's not the program, the blue folder. So the SCD Treatment Centers Act is a national legislation that's really trying to make sure that we have centers of excellence throughout the nation to adequately and comprehensively treat people with sickle cell disease. So we do want everyone reaching out to their members of Congress to try to get this bill pushed through the House. But there will be a QR code. I'll make sure we have it. We just have to. There we go. So that will take you to a website that has the list of national legislations. However, does sickle cell cover all states?
Yes.
Okay. So they have everything from every state that's going through legislation? What's right. All right, well, our next session, first of all, any other questions? Because I want you guys to be able to get some food, come back to your table, and then we'll have the panel discussion with our legislators. All right? Okay, let's go ahead and get our food. Thank y'all so much. Shout out to Palmer's Eatery. And how was the drink? Did y'all try the MTS lemonade? Oh my goodness, yes. All right, so we've learned about how to own our narratives. We've gotten some tips on how to engage our elected officials. So now we're going to hear from some of our elected officials, both present and some current. So now I would like to call Howard Mosby to the stage. He's going to be our moderator and he's going to introduce this session. Yay!
Good afternoon. This is going to be awesome. This is going to be awesome. What the sister said, I got all of my friends with me. So I want to bring up actually, so Senator Davenport, she put it back to me. I'm not coming up there. I'm going to eat my stuff. But I want to bring up Amari Crawford and former Representative Stan Watson to come up here. We're going to have a conversation. There you go. Bring them. These are some heavy hitters, and these are some heavy hitters that we're going to talk about policy and how policy is made here in Georgia. So, first of all, my name is Howard Mosby. I'm a former legislator here in the state of Georgia. I'm also a long-time employee of the Grady Health System. So I've seen health policy made, and I've seen health policy implemented. And there is a huge gap for our community. And so one of the things that I did after I got out of the legislature was start a nonprofit myself to look at how do we close this gap. We call it the HEAL Collaborative. And what we do is we go around the country and we educate communities around issues that have this adverse effect on communities of color. So how many of you know that in lung cancer, for instance, it is the #1 killer of cancer in the nation for lung cancer. Lung cancer kills more than any of the cancers combined. It disproportionately affects our community, and we don't know it. You walk into a Quick Trip, you walk into a racetrack, you walk into any one of these little convenience stores, they're selling the Black and Miles. One Black and Mile is worth 4 cigarettes. So people think they're cutting it down, they're actually smoking more. You go into a hookah lounge, 1 minute, 1 pack of cigarettes. 60 minutes, 60 packs of cigarettes. So you think you're not getting something, so you're actually increasing your risk in this space. Well, today we're here to talk about sickle cell. But this panel discussion right here, we're going to talk about how do you advocate with your policymakers. So one of the things that I'm going to talk to my esteemed colleagues up here about is how bills are made and passed in the state of Georgia. But before we do that, I want my colleagues to introduce themselves so that they can tell us a little bit about who they are. We're going to start here with former Representative Stan Watson.
Good morning, or is it still morning? Good afternoon, okay, good afternoon. My name is Stan Watson. I'm a former state representative from DeKalb County. I replaced Thurber Baker, who was the Attorney General in 1996. I was chairman of the largest Black caucus in America at that time for 2 years, which was the Georgia General Assembly's Georgia's Black caucus here in Georgia. Also was the chair of the DeKalb House delegation for 10 years, so I held both of those positions in DeKalb County and in the state of Georgia. Served on responsible positions in the General Assembly from appropriation, health and human services, insurance, and public utilities. Served 3 governors, the Governor Zell Miller, Governor Roy Barnes, and Sonny Perdue. Served 3 speakers, the longest serving speaker, who was Thomas Murphy, Glenn Richardson, and also Harry Coleman. Spent about 10 years down in the Georgia General Assembly, and also spent 6 years as a DeKalb County Commissioner. I'm glad to be here this morning.
And good afternoon, everyone. I am Omari Crawford. I'm one of the newly elected state reps, also out of DeKalb County, so it's odd that you have two DeKalb County people up here. But I've been in the General Assembly now for 36 days and counting, or who's counting. I'm very excited to be a member of the General Assembly. I'm an attorney by trade. I actually work as an attorney with the DeKalb County Law Department, so I have a unique perspective on local government and how it interacts and how it is impacted by our state government. I am on the Budget and Fiscal Affairs Oversight Committee, the Intergovernmental Coordination Committee, and last but not least, the Judiciary Committee. And I have the esteemed pleasure of being one of the deputy whips for the Democratic Caucus, as well as a member of our policy team. So as a freshman, I've been doing what I think, some really good things and just adding to our Democratic Caucus. And I hope to continue to do more. That's why I stay close to people like Mr. Watson and like Mr. Mosby, and just ask questions when I need a little more understanding, as again, it's just a lot to learn, and I'm really enjoying it. So thank you for having me. Last but certainly not least, I am also on the board for MTS, and so I love having the opportunity to advocate for sickle cell while I'm a member of the General Assembly. So thank you.
Thank you very much. I'm State Senator Gail Gallant, I represent the 44th Senate District, which includes portions of Plain County and portions of DeKalb County. I have two precincts right now, 920. So I'm in Atlanta, the Atlanta delegation, Plain delegation, and the DeKalb delegation. Just delighted to be here, certainly with my colleagues. They have all the answers to all the questions that they have. And they have an attorney there also, but they get things done, and they can really explain to you about policymakers. Sickle Cell Foundation is really one of my favorite charities. I raise money for sickle cell, with my dog and some other things, and sickle cell really comes to Clay County for our 14th celebration that we generally have each year. For the last 5 years, they have done that throughout Clay County. And just thank you so much for what you're doing with sickle cell. And we know how this affects all people, but you must be engaged with your elected officials, your policymakers. You've got to be engaged with them. And that's people in the community. Tell your story. Tell them what you're doing. Tell them what you're going to do. My cousin has sickle cell, and as a young person, he was in and out of hospital so much. And it affects the whole family. So I am delighted to be here today. If there's anything I can do, just give me a call. I appreciate you so much.
Thank you very much. All right, so we're going to get into it. So we're here to answer the question, what the heck do they do behind the door? Right? You drive out there most times, and you say, that is just a building that is blank sheet of gold, what are they doing actually? And these individuals right here are individuals stand like this, Omari and Timothy down before. What they do in the gold affects everyone in this room. If somebody in here can tell me something that is going on in your life that's not been affected by public policy like one day. The only people in America that make public policy are elected. And if you don't engage with them, if you're trying to move the needle of public policy, and you're not engaging with your elected officials, you're spending your rules. And so this is why this kind of advocacy meeting is important for you to be a part of. So we're going to kick it right off. So Representative Crawford, you said a lot there. He said he was deputy whip, and he sits on a committee. These things are important in the legislature, maybe in the tell them, sir, what the deputy whip means.
Thank you for that. And so I didn't really know what it meant before I actually started serving either. Each party will have what they deem to be a whip, a person that goes around and tries to figure out how their caucus is going to vote, and then tally how each caucus is going to vote, so then you have in your mind the number of how we can gain some leverage for a particular bill that may hit the floor. If there is a need for you to change a vote, you need to know enough about that policy so that you can convince people sitting around you how they should vote one way, because it may impact or some of the unintended consequences of a particular bill. So as a member of the Deputy Whip team, I'm going to be staying later at the Dome than most people, because any bill that's going to hit the floor, I need to understand what that policy looks like, the unintended consequences, and how it will impact each district. So now I have to convince, if you will, some of the people that sit around me that are also Democrats, you need to vote this way, and let me explain to you why you should vote this way. This policy will do X, it will do Y. There will be unintended consequences, sure, but those unintended consequences are not so impactful that you should vote no against it. This is a really good bill. Or, inversely, a lot of times they're going to be terrible bills that may have the most wonderful titles at the beginning. Omari, why would I vote against this bill that says X, Y, and Z? Well, because it may put a whole bunch of black people in jail, or because it may negatively impact the schools. So that's really what a deputy whip does. Just again, learning the policy and being able to explain it to people to convince them to vote one way or another.
That was awesome. And he said a lot of important things in his answer. But all of it really is about his ability to be able to actually talk with and negotiate with his fellow colleagues. So, Stan also, he didn't say this, but he also served another year on the DeKalb County Commission as well. And so he's seen policy made at the local level, he's seen made at the state level, and he was part of a national organization that saw how policy was being influenced at the national level. But you heard Representative Crawford talk about working as chief deputy or deputy whip and putting these both together. How important is it to be able to not only be able to talk to your colleagues who are on whatever side of the aisle or on the Democratic side, but should we be looking at advocating with people on the other side of the aisle? So tell us the importance of being able to have a relationship across.
That's very important when you are in the minority, such as we have right now in the Georgia General Assembly. The Democrats are in the minority. And so the secret to any success in getting your district funding, getting bills passed that relates to health care, those kind of things, if you're in the minority, is always talking to the majority. The majority right now in the Georgia General Assembly are the Republicans. One of the things that served me well in the Georgia General Assembly is learning how to go across the aisle and dealing with the Republicans. And the way you do that, you try to find out what things move them, what things move them in their district. But you have to also make sure that you understand the dynamics of the state of Georgia. So if I had a friend from Rome, Georgia, I had to make sure I knew the things that were important to that person, male or female, in Rome, Georgia. If I had a friend down in Albany, and Albany, Georgia is more agriculture and pecan capital of Georgia, I had to make sure I knew about the storage facilities and cotton and pecans down in Albany. If I had a friend in Savannah, I had to know about the ports. I had to know about shrimping. If it was Brunswick, I had to know about the ports and the dredging in the harbor in Brunswick, and how we brought cars, Toyotas, and different other automobiles into the state of Georgia. If it was just Vidalia, I had to know something about Vidalia onions. So there is an art to knowing your other side of the aisle. So if I knew something about the other side of the aisle, I could always have a conversation about what was going on in their community, because if I had to do a population deal for Clayton County, for DeKalb County, or for the city of Atlanta, then I could tell them how important it was, this bill for my constituents, that lived in DeKalb County, that lived in Clayton County, or lived in Fulton County, or for people that look like me. But you have to have some type of relationship with those people to make sure there was a bill that was important. I.e., we're here this morning to talk about sickle cell. So if I know to talk to people about the kaolin industry in Rome, Georgia, I'm sure that they can sit down and talk to me about sickle cell in the state of Georgia. That's how the system works. Now, if you don't have those kind of relationships, you'll never get anything done. Let me help you to count. There are 180 members in the state of Georgia in the Georgia General Assembly. It takes 91 votes to pass a bill. Is that right, sir? So if I don't have 91 votes in the Georgia General Assembly as a Democrat or a Republican, that bill does not become law, or that bill does not go across to the state, to the Senate, and the governor eventually does not pass it. So out of 180 people in the Georgia General Assembly, I have to sit there and figure out why I like Omari for this bill, why Omari likes me, why I like to talk to this person that might be gay, why I like this person that might be a redneck, why I like this person that might be a teacher, why I like this person that might be a farmer, because I need this bill passed for health care so the Sickle Cell Foundation can get funding so that we can do research that won't be in England, will be in the state of Georgia. So that's how important it is for us to work across the aisle to make sure we get stuff done.
No, thank you, and I think that answer was spot on. I can kind of give you an example as well. Not only getting to know people is important, building those relationships, but also doing your research so that you can explain to people across the aisle how something will impact their communities as well. And I think that's what Mr. Watson just said. One of the examples that I can discuss, even in my young legislative career, there's a bill that hit the floor. It's called, it's House Bill 404. It's the Safe Home Act. And in that act, for the first time in Georgia, we are going to expand tenant rights in 3 ways. One, you're going to expand tenant rights by prohibiting landlords from taking more than 2 months' rent for a down deposit. That's never happened before. We've never put that in law. We're going to expand tenant rights by allowing tenants, should they not pay their rent on time, they have 3 days to cure. That is 3 business days to cure their evictions, right? Before there is an eviction filed. Because as you know, if there is an eviction filed, then that's going to have a negative impact on your life. There are so many collateral consequences. If an eviction is filed against your life, it's going to impact your health. It's going to impact your ability to live in another place moving forward. And last and most importantly, we put language now what habitation looks like. So now we've eliminated slumlords. Well, the reason why it was important to work with Republicans, a Republican actually authored this bill. And I was asked to sign on to the bill because it was going to come through the Judiciary Committee. I just told y'all what the bill looks like now. With the bill, when it came to me, it had some other language in there that I did not like. There was language in there that would automatically terminate your lease should you violate certain areas of the criminal code in Georgia. I signed on to the bill even seeing that because in my mind that there was an opportunity that we can negotiate with the Republicans should it come through the Judiciary Committee. We have a very extensive criminal code in Georgia, right? We're talking things from murder and rape to also simple assault. What I did when this Republican came to me and said, would you sign on to this bill? Sure, but in committee, I asked some tough questions. What I also did is that I asked one of the sheriffs from his hometown to come in and, to speak to this committee about how that criminal element could negatively impact, guess what? All those students in UGA, Georgia, they love to say go dogs. Well, let me tell you what, if somebody that doesn't look like us gets into a fight inside of their dorm room or inside of one of their apartments off campus, that person, if we keep this criminal code in there, is going to now be evicted. That's going to impact so many people that you may care about in your area. It's also going to cost your county approximately $10,000 for every eviction. He understood that. We took that out. So sometimes, as Mr. Watson said, when you develop those relationships, you do your homework, you do your research, you can perfect the bill, make it a little better through negotiation that we were able to have on the Judiciary Committee. So again, sometimes You may not be able to alter a bill yourself, but you can negotiate and make it better if you have those relationships, and so that worked. And so that's something that I would say, as Mr. Watson said, the relationships and being able to do your research is extremely helpful.
Again, a great answer to an issue that's extremely important, that is how you work with your colleagues. Now, they talk about working with colleagues across the aisle. I got to do this. This is talk about the policy advocacy that came forward earlier, but the biggest hurdle that we have, and you're going to have, is dealing with the organic over in the Senate. Which means that goes to the House, goes to the Senate, and don't get signed, and pass it hard. If the bill goes from the House to the Senate, and the Senate changes it, has to come back to the House to be either agreed upon or not. And then if the House agrees to that change, then it goes to the governor. If it don't, then it goes to a something called committee, where the House and Senate develops these special committees here, at least the legislature. There's a lot of negotiations that happen between the House and Senate. So how important is it to have a relationship with your colleague also in the House, the chamber, to make sure that the legislature is
I can talk to that if you don't mind, Mr. Watts. So I'll use an example. The bill that I just discussed that extends or expands tenant rights was heard in the Judiciary Committee in the House. It is now going to be heard in the Judiciary Committee in the Senate. And so I have tried to be as aggressive as I possibly can be without annoying the people in the Senate. Senator, I have annoyed some of your colleagues, and that is just reaching out to them, letting them know that this is a very important bill. There could be some changes made that'll make the bill even better. Let's perfect it even more if we can without doing too much that it does not pass. Some things will not be perfect, but they can be good. And so I have had conversations with Senator Harold Jones, who is the minority whip for the Senate in the Democratic caucus. He's also an attorney. He sits in the Judiciary Committee. Mr. Jones, Senator Jones. These are some things that I think that we can add on to this bill without breaking some of our progress. And so I think it is important, to have those sit-down conversations on how we can continue to move this forward.
I would agree with that wholeheartedly. I guess I'm old school, but I did it the old way. I was trained by the old heads. So what I would do is if I had a bill that was very important to me, I would probably pick a senator on the other side to have a companion bill. And I tell that senator, this is my bill, and I'm gonna give this bill to you over the Senate. And you can be the author of it because it will come back to the House anyway. We're gonna get it passed because it's the best thing for Georgia. So I picked Senator Davenport. I said, here's my bill. It's on paternity fraud. And we're gonna make sure that a dad is really a dad and mom ain't just trying to get the money. So I'm gonna give you this bill. And Senator Davenport has the bill. I have it in the House, she has it in the Senate. But when I get ready to go to the Senate, I will go to the committee chair over in the Senate, but I'd also go to the lieutenant governor and say, look, I got a bill coming over here, and I don't know what I need to do to get it passed. I got Senator Davenport who will help me with it, and also talk to the chairman of the committee to make it work. But the other thing is that, and we talked about it earlier, is about the relationship. And the relationship I probably would have is that, and we don't do this anymore, when Howard and I were down there, we had activities together between the Senate and the House. Something as simple as a basketball game, where we'd have all the basketball players come and play basketball, so we knew who everybody was, and we asked the ladies to be cheerleaders. So when the bill came through, I had everybody I know that needed to know, but guess who the manager of the team was? It seems funny, but guess in the federal government, guess what they do for their activity? They do a baseball game between Democrats and Republicans. They put them all on the same team. So my point is that, like Mr. Representative was saying, yes, So I'm gonna take the companion bill and give it to Senator Davenport. I'm gonna talk to the Senate President, who's the Lieutenant Governor, and I'm gonna talk to the Chairman of the committee and make sure. Now, there has been times when that has not happened, and I would do a bill, say, on fast oil and grease, fog bill, for greasing your sink and stuff. And I've had people that work for Waffle House or some other industry steal a bill, and I sent it to the Senate. Before I know it, they change the number of the bill and it's their bill now. And then send it to the governor and got it passed. So you have to have relationships to make sure it works. Otherwise, it's going to be terrible trouble for you. I think we can draw in with that one.
Just that simple. So, everybody advocating for that. But since we're not in the majority, we have to have those relationships where we can go to the chairman of the appropriations committee and say, we need some more money in the budget from the Senate side, because the House has already done it, to make sure that sickle cell gets the same money. Thank you.
Excellent.
Actually, she set us up great for the next part of this conversation that we're going to talk about the policy piece. One of the reasons why we did it this way was, I wanted you all to know the sausage part of making policy. The things that your representatives and your senators have to deal with inside the whole government. But see, you all live it. They do, you all live it. One thing that you want to know is, how do I engage with these individuals? How do I ensure that what I want to have happens? And I want you all to know some of the challenges that they face, even though your issue might seem simple or might seem like it makes a lot of sense, that they have to run with a lot of machinations in order to get that particular policy made. So earlier we had our panel talking about policy and advocacy, but the issue here is, how do we move an issue forward? So right now, Representative Crawford has a bill that's called the Mapilla Dawn. How many y'all know that? Yes. What is that? Now, this particular piece of legislation is strictly around how to the legal around sickle cell and funding of this activity in the state of Georgia. How is it that they can help you get that back?
That's a good question. I will tell you just the background of this bill. The background of this bill is, of course, again, I'm on the board for MTS, and right before session started, I had a conversation with our CEO. She and I emailed each other. I'm asking her, how can I be an advocate for sickle cell? We did some research. She gave me some information about a bill that was passed similar to the bill that we're working to pass in Georgia that had been passed in Tennessee. This bill passed in Tennessee, and some other states have subsequently come afterwards, such as Florida, Kentucky, Louisiana, and Mississippi. So we did a study of what that bill looks like, and what the bill would do is that it will create an annual review board or a review process so that policymakers and local physicians and just the communities would have an impact and input on the treatment and medication that those that are impacted by sickle cell would be able to study the medication and treatments that they receive. And we did all of our research, we looked at all of the laws around the South, and what we learned is that there was no fiscal budget, there was no money required to pass this bill. All of the states that we named that are even redder states than Georgia voted their senator bills unanimously. And so we had all of the information that we needed. In fact, I actually called our CEO to come down to the Capitol so we can go to one of the chairman's office. He actually signed on to the bill himself. He agrees with this bill, Republican, okay? While we were in his office, we actually called Morehouse School of Medicine. And the Morehouse School of Medicine, they like this bill. They think it's a great bill. I continue to do my homework, called the community health and asked whether or not they would be opposed to the bill. They thought it was a common sense bill. So everybody likes this bill. This is what happens. The bill went from what we thought was going to be the health committee. It was then switched over to the public health committee. And so I have been talking with the chairwoman of the public health committee to see if we can get a hearing. We got everything that we need, but we need to get it. We have the signatures, bipartisan signatures. So right now, what I can ask you to do, when we have bipartisan support, which we do, is to call your local legislator. Come down to the Capitol when we're in session, as I have seen some of you come down to the Capitol, and advocate for what a Republican, a chairman Republican has said is a common sense bill that will not cost the state, but it can help out so many people. come down to the Capitol and continue to advocate for. We're not going to stop. We're going to continue to make sure that we advocate for this bill, but I can use your help. So I just wanted to kind of give a background information on, again, it's a good bill. It's a great piece of legislation, and a lot of people like it, but we need to have a committee hearing. We have had very few Democratic committee hearings in public health, and so we just need to make sure that we get this thing heard. And if you go inside of your program, you will have the information on what this act actually does. Again, the Mapilla Dunn Act, and it is on towards the end of the program, the last page, and just give you some bullet points of what this bill will do.
That's awesome. I can really give me a deal with my name. How opposed to that? I think everybody wins Powerball every time.
I think that's an excellent way to do it. I just think that everyone needs to call their legislators on that particular bill. You say it's no Democratic movement, so to speak, and so I think that's just something you have to do. Is just reach out to your legislators and make sure that they understand what's going on with this particular bill.
So policy advocacy is huge for all of us in this room, making sure that the issues that we're here for, which is sickle cell, that we know how to interface with our legislators. It is not, let me just say this, it is not, it doesn't take rocket science to run out there. It doesn't take that you have to have some special anointing. I'm trying to go with the circle. That's some special anointing. Take you in all of your units to that space and say, this is what I am asking for, Mr. Representative, Mr. Representative, the Senator. I'm down here on this issue, and I need you to hear it. And so,
Well, I think the other part, I think once you become an elected official, and this is most important, you hear this when people are running all the time, and they say, well, I want to make sure that this elected official is going to be accessible. You know, what does that mean? I want to make sure that this elected official is going to be approachable. Well, see, once you're an elected official, you have to be accessible and approachable. Accessible means that if you're somewhere in the grocery store and I got a problem, you got to be willing to be able to listen. You got to take those 5 minutes to talk to me about this sickle cell bill that I just asked you to advocate for me. You know, even if I'm trying to get my Clorox, even if I'm trying to get my milk and eggs in Kroger or Publix or where, I got to take 5 minutes to talk to you about this particular bill. Otherwise, you need to get out of the game. If you don't have time, if your elected official does not have time for you at Kroger's or Publix, he or she does not need to be your elected official. If it's after church, not during the worship service, and that was just one of my rules, and I go there. During worship service, I'm an elected official. Don't bother me when I'm worshiping. Now, when we do the benediction, till we meet again, and I'm walking out, you can talk to me about anything. Anything about your child going to this particular school, the child need a letter to go to this ROTC school, your child want to change schools, whatever you need. You can talk to me after church, but during the worship service, no. If we had a PTA meeting, my whole point is this, ladies and gentlemen. If your elected official is not accessible, that's what accessibility is. If your elected official is not approachable, you know how you get in a relationship, you see a pretty girl or a handsome guy, and that person is not approachable, you don't want to talk to them. So if I'm an elected official, I'm not accessible or approachable, why y'all elected? Why we gonna talk about health care and trying to get a sickle cell bill or any other health insurance change or funding for a special program? Why we talking about that and you elected somebody you can't talk to? Does that make any sense? I digress.
Good morning, Dallas. I have a question. I heard working across the aisle. I
session this year started January the 9th, and our last day of session is going to be March 29th. So the Constitution says you have to be in session for 40 days.
My last question is, I also heard about working across the aisle, maybe working with the Republicans and the Independents, therefore. I also would like to know, what does it mean to bring a bill to policy from a committee to go to the will?
Oh, try a little bit. You say bring a bill and take it to the well. If you get a chance to bring a bill to the well, you've done a great deal of work. Because a bill comes from an idea, or a bill comes from a citizen, or once you go through the committee process of getting the bill to the well, that means that it's gone through the committee process, it's gone to the rules committee, it's been vetted, everything has been done. When you go to the well, it's time to preach. You go to the well to explain why this is a good bill. You go to the well to make sure you're asking for, if you're in the House, you're asking for 91 people to go along with your votes. You're asking for 180 people really to go along with you, but you're praying that 91 will go with you. So if you got 180 people to go with you, you're good. If you get 91 to go with you, you say, thank the Lord. So you go to the well and say, please vote for this bill, and you get a merits of the bill. It may not be a huge physical cost for the state. It may help the young people. It may help your community. It may help the community in Rome. You just tell them the story. You tell them this story. And then what you got to do, be prepared to defend the bill. Because Omar is going to stand up and say, does the gentleman yield? And you got to say, yes, I yield. Yes, sir.
I'm going to add one more thing to it. Not only will you have a million questions, you may have someone like Omari who has done this time and time again. I may stand up and tell you why I think that bill is terrible. And I may stand up for about 5 or 10 minutes and explain to people why they should not vote for your bill, which actually just happened this past week.
I got to defend the bill now, so look.
So now we're back, absolutely.
You see how we talking to each other now?
Yep.
So does the gentleman yield? Mr. Speaker, I don't want to yield right now. I haven't finished, Mr. Speaker. Mr. Speaker, I can't even hear it here. Mr. Speaker, can you get some order so I can hear this gentleman been up? Mr. Speaker, how long are we going to debate the bill? See, you have to learn how to play the game. See, if I'm a dedicated, seasoned veteran, and Omar is giving me a hard time from this seat up in the well, I know how to handle Omar. Does the gentleman yield? Not yet, because I haven't finished speaking. You play the game. You act like you're the NAACP. No, I don't want you to talk to me right now. When I finish, I'll let you talk. But right now, you're not talking to me, because I haven't finished. Would it deal with you? No, sir. And then I just said, Mr. Speaker, can you get some order in here, sir? You gotta learn how to play the game. But once you defend yourself and you do it professionally, I might change tomorrow's mind. I don't know. But at the end of the day, we had a good conversation. He asked his questions about the merits of the bill. He defended his decision not to vote for the bill. He told some people in this party, don't vote. This bill gonna hurt DeKalb County. That's all he had to say. How many votes we got in DeKalb County? 17. He got 17 votes in DeKalb County. Guess what he just did? He told 17 people in DeKalb County, do not vote for Stan Watson's bill in Clayton County. How many votes we got in Clayton County? In the Senate? Just how many in the House? 6. Okay, so she says don't vote for this bill. She just changed the mind of 6 people. He just changed the mind of 17. How many votes did I lose out of 91? Can y'all count? You gotta be able to do this right quick. You just can't elect anybody to go down there. They can't count. Hello? I digress.
Your question is whether or not there's a life insurance policy for sickle cell. So I'm unaware of any policy for that right now. The bill that we were trying to push is going to be more so for the medication and treatment and understanding the data, how we can collect it. Because right now, there are numbers that we believe the amount of people that are impacted by sickle cell in Georgia, but there's not a national registry for people who are impacted by sickle cell. So what we're trying to do is collect the data. Once we collect the data and able to review the medications and the treatments, then we can probably move a little further to figure out how we can best help.
Yes, I have some medication, like Australia or James or something like that. They're like, okay, they'll see that on your record, like, okay, you disqualified for this policy because of the medication that you are taking. So sometimes they won't even enroll you in life insurance, which is very important for a lot of us to have. You know, look at our families and take care, you know, make sure they are taken care of.
And I'm just saying this because my kids have sickle cell, they have life insurance. When we were getting the insurance, I think it just depends on the company. So whoever is soliciting you for life insurance, the upfront of them let them know that you have sickle cell disease, they cover you. Now, what we did experience, even though they were going to cover my children, is my oldest daughter, because she was over 18, they had to run her medications, something like that. Like this 20-year medication. And because of